Hello, everyone. Welcome back. I'm Mary Holden. I'm with the Idaho Caregiver Alliance, and it's good to see a lot of familiar names in this list. I've been involved with this conference for many years, and today has just been amazing. I was so moved by Dr. Trump's presentation about being the caregiver for her mom and fill in the blank for all the other roles and responsibilities that she's taken on. And then just watching the movie, The Caregiver, A Love Story, again, it reminds us of the challenges that people face that are family caregivers. Before I introduce our next presenter, I want to mention a couple of things you'll hear references to when I read her wonderful bio. But the first is you'll hear about Daughterhood Circles. I think we've mentioned these before, but they're groups of caregivers that meet. Different circles are all around the country. We meet to support each other, share our stories. We do have a caregiver circle in Boise. So feel free to contact me if it's something, a Daughterhood Circle in Boise. So let me know if you're interested in being a part of that. And then also, if you live outside of the area, you can also contact me and I can help you to start one in your area. And then the second resource that you'll hear about is Daughterhood the Podcast. I don't know about you. When I walk, I love to listen to podcasts, and Daughterhood, the podcast, has been so informative for me. New episodes drop every second Thursday of the month, and you can get it wherever you listen to podcasts. And again, in the chat after my introduction, I'll put that information too. You can get to it at daughterhood.org, and you can listen to all the previous podcasts that have been put together over the last couple of years by our next guest. So now I'm so happy to introduce you to Roseanne Corcoran. She and I have we've never met in person, but we've become fast friends over Zoom, kind of this new virtual world that we live in. She lives in Philadelphia and I live in Boise, but we were able to, like I said, we've become friends, and I just so enjoy her company. And I am going to read you her bio so that I don't miss anything. So Roseanne cared for her mother with vascular dementia for 12 years. And the last 6 years, her mother actually lived with her in her home. Roseanne soon realized that she was a part of a much larger community of people kind of having the same experience. And she started doing a lot of research into caring for aging parents. And this research led her to start a regional Daughterhood Circle in the Philadelphia suburbs. Understanding there was a larger audience who would benefit from this information, Roseanne created Daughterhood the Podcast, which we just talked about. Roseanne has been featured on CNN Health, in the Philadelphia Inquirer, Barron's, and others, discussing everything from caregiver burden to the portrayal of dementia in films. She also leads a bi-monthly dementia support group for Judy Cornish's Dawn Method graduates. And Roseanne also was the recipient of Caregiving.com's 2021 Visionary Award. And as you'll see by her presentation to us, Roseanne is currently working with Dr. Jessica Zitter as she develops workshops designed to educate and empower family caregivers to seek and obtain support centered around the film Caregiver, A Love Story. Roseanne?
Hi. Thank you, Mary, for that wonderful introduction. That is quite a film, isn't it? Caregiver, A Love Story. If you have questions, please place them in the chat and I'll address them. In the meantime, I have a few slides to share that speak to caregiver burden. If I can get that working. When Dr. Zitter set out to make this film, she thought she was making it about her friend Bambi, who chose to die at home. What she realized after watching the rough cut was that this film was really a story about Rick, her husband and caregiver. As you saw, Rick cared for Bambi for the last 9 weeks of her life at home. But as the film shows, you notice how Rick's life changes suddenly at first, without the ability to ignore as time goes on. The change builds pretty rapidly. What we viewed normally starting out as a joyous celebration of Bambi's life and of them being at home together soon became an exhausting and stressful experience for Rick. What Dr. Zitter realized was if the Ricks of this world are struggling to take care of the Bambis, whether it's physically, emotionally, or mentally, the Bambis can't have what they want, which is to die at home. This problem is only going to get worse as our baby boomers age and families shrink and dementia rates rise. The medical system has shifted the burden of care from the healthcare system onto unpaid family caregivers, and there's no national strategy to support them, to support you. So this film is for all of those caregivers who are struggling to support their care partners. We want to give you some context on the issue of caregiving in America. And first of all, you know that you are not alone and that the work you're doing can be overwhelming. Statistically, we know 1 in 5 Americans is caring for someone in need in their homes, and that number is rising. Caregiving can be overwhelming. The statistics show that caregivers provide care for an average of 4.5 years, 24 hours per week. As a former in-home primary caregiver, I believe those numbers are really too low. 31% have used up their personal savings. 50% do it alone with no outside or family help. 60% of caregivers have symptoms of depression, and 67% of caregivers say they do not go to the doctor because they put their own care recipients' needs first. As we saw with Rick, he had some advantages. He had a financial cushion, he had a supportive community, and a supportive and appreciative partner he could communicate with. He also cared for Bambi for only 9 weeks when the average is 4.5 years. Yet he faced profound challenges, which I'm sure resonate with all of you. Overwhelming range of duties, the laundry, the cooking, the shopping, the child care for his granddaughter, Maya, all while caring for Bambi. His own exhaustion from being on call 24/7. The financial stress, he couldn't work, he had no employment relief, and he used up a lot of his savings. And of course, the emotional duress, the guilt and the grief. I want to get on with my life, and this isn't what I signed up for. And when he placed Bambi for respite, she declined. His medical challenges, he wasn't able to exercise or do any of the self-care that he was used to, and became so run down that he had to place Bambi. Now, part of caring for yourself, and I believe it's the elephant in the room when it comes to caregiving. It's grief. Caregivers may feel it, but they don't recognize it. It adds to that heaviness that we all feel. There's ambiguous loss, which is a term coined by Dr. Pauline Boss. It's a loss that's unclear. It has no resolution or a predictable ending or closure. And this feeling of ambiguity happens because you're suddenly thrown into a situation where you have no control over what happens next. One example is those caring for someone with dementia or cognitive issues. While you recognize they're still alive, you may not know how to make sense of the loss that you're feeling. There's also anticipatory grief, which is the grief that we experience in anticipation of death or some other life-altering event. This type of grief can be felt over the loss of your career, your income, your home, your relationship, or any other significant loss in your life. Other things that may cause this grief are the fear of what's next, the loss of companionship, and a change in finances. This type of grief can create confusion for you as you struggle with keeping hope while you're letting go. We've come up with some questions to assist in acknowledging your grief. What are the losses you are experiencing? What is most surprising or unexpected for you that is a loss? Sometimes they can catch you off guard. What is something you wish someone knew about your experience? And what are you missing right now? The self-reflection part of caregiving doesn't really happen because we're putting all of our energy out. And sometimes we don't realize what we need. So we came up with a few self-reflection questions for you. What would be most helpful right now? What would a rest or a break look like for you? Not when somebody says, oh, you should do this. What would help you? What does my body feel like right now? It's another one of those moments where you're going. You don't even realize what you need. This is an inventory for your own body. What one thing can you do for yourself every day? And what brings you joy? And it's not happiness, joy. Joy is different. The other thing that we talk about is self-care. Now, I know as a caregiver, the term self-care used to make me furious because I thought, how am I taking care of myself when I can't even take a shower? And these are a few things that self-care can be. It's letting go of extra obligations or commitments. I call this a should-ectomy. I should be doing this. I should be doing that. No, you're caregiving, and caregiving takes so much energy. And I don't know if people realize that. The outside people realize that. We as caregivers realize that. There's also a grounding exercise because we're so out there all the time. We lose track of where we are, and grounding helps you be present in the moment. So it's a very simple exercise. It's a 5, 4, 3, 2, 1. 5 things that you see, 4 things that you can touch, anything, a pillow, a pen, anything. 3 things that you hear. Again, it could be anything, could be your stomach rumbling. 2 things that you smell, and 1 thing that you taste. Those things bring you back to the present moment. It keeps you from worrying about the future or awfulizing about the past. There's 4-7-8 breathing, which reduces depression and anxiety. It reduces stress levels. It improves our motor memory. I don't think I took a deep breath for the last 6 years. How we do 4-7-8 breathing: you close your lips, you inhale through your nose for a count of 4, you hold your breath for a count of 7, and you exhale with a whoosh for a count of 8. So it's, and it clears, it resets your parasympathetic nervous system that just continually runs, whether you realize it or not. One of my favorites is to read or listen to audiobooks or podcasts. I could never really read because I was so tired, but I could always listen. And you can listen anywhere, right? You earbuds or whatever. And the processing that happens in our brain's cortical area is a benefit to us and to our brains. And some neuroscience believe that even if you listen to a book, it actually increases your empathy because you're hearing the person's tone, which is helpful. And I always thought it wasn't as good listening as reading, but that's been proven false, thankfully. Unfollow who or what or anything that drains you. If the news upsets you, stop watching it. If you have social media accounts and find yourself scrolling and at the end you feel worse about yourself or about your day or about anything, deactivate your account or remove yourself from those groups. Remove anything that you can control that raises your blood pressure or level of aggravation. And that includes people. If you know there are people that you speak to that just get to you, let it go to voicemail. Don't respond to a text. Give yourself a break. Journaling has been a huge help for me through my life. And it's a great stress reducer because you can do it at any time. You can do it anywhere. And it just gives you a chance to release those thoughts that are whirling in your mind. Put it down on paper. It could be a journal. It could be a copybook. You could rip it up and throw it in the trash. It doesn't matter. It's just for you. Revisiting a passion or a hobby sounds out there, but it's helpful. If you like to cook, say, and you look at, recipes, or you look at pretty pictures of food in a book, something, drawing, painting, coloring, anything that gives you your mind, that break is a help to you. And the last one is music, listening to music. And I don't know if we give music enough credit. It's something that you can do on your own. It's something you can do with your care partner. Music just brings you back to a happy time or a different time, but it boosts the brain's production of the hormone dopamine. It slows down, again, our parasympathetic nervous system. It just brings really, it's an easy fix. And when it comes to professional help and resources, it's your local area on aging or a disease-specific website is probably the best way to start. You have a wonderful resource with Boise right there for you with the Family Navigator. But there are medical resources that include hospice and palliative care, the home health services, the physical or occupational therapy. There's respite care, both in-home and short stays in care homes, and grants to help pay for some breaks. There's the community resources of adult daycare, meal delivery, transportation help, home modifications, and also managing stress, support groups, counseling, caregiver classes. For caregivers, nothing made as much as a help for me as much as sharing with other caregivers, because you never have to explain where you are or how you feel. And I'm not a support group person. I'm not that person, but I am now. And it helped me immensely through my entire process, just to know that I wasn't alone. With professional help and resources, it's always helpful to be clear about what you need when you call them. Is it medical? Is it household? Is it respite? Is it stress management? Find out if the agency does provide what you're looking for. You can find out if you do qualify for it based on your location or your insurance. Also, what will it cost? And what are the next steps for you? So those are a few tips that we've come up with to help just try to find a way. There's also, we like to call it homegrown help, which is people that are around that you may not realize. A neighbor, a friend, even a friend that you haven't met yet, someone in your community that can help. The advent of home delivery meals and things that we can access now through the pandemic is helpful for caregivers, but it's always nice to have somebody around that can help you as well. So I thank you for watching this with us. I thank you for being here with me today. I will answer any questions that you have regarding the film, regarding the podcast, regarding Dr. Zitter, or just caregiving in general. But I wish you all good health in your life and peace in your minds and comfort in your hearts, knowing that you are doing heroic work in whatever caregiving way you are doing it, and that you matter. For more information with Jessica Zitter, you can go to her website at jessicazitter.com. You can find my podcast at daughterhood.org or wherever you listen to your podcast, and on social media. I have my tabs up, but if you have questions, we can certainly go over them as well. I'm going to look in the chat here. There's a question about finding in home caregivers that have no way to accurately show how much they are doing. There are no standards for documentation guidance, which is vital to ensuring that supports needed are given. You are right. I had a binder that I made up for every caregiver that I had. A list of things, a list of the television shows my mother watched, a list of things that she would do that I would know what she needed help for, and that they could then help her from these behaviors. I don't know if, when it comes to documentation, when you privately hire a caregiver is different than through an agency. They usually have a list. And it's a shame. Everything needs to be some sort of standard form, which would be very helpful in all of these. Let me see here. Questions about just dealing with everything. It's so hard as a caregiver because we are so isolated and because we feel so removed. And I think that's part of the challenge in trying to make people understand, because we're exhausted and we're trying to explain something that you can't quantify, that you can't say, I'm tired because of these three things. It's hard. And that's part of the challenge in trying to convey that this is hard work and this is serious, and we need to have supports in place. let's see, would it be possible to share a copy of the form? I could pass that along to Mary, of course. Absolutely. Daughterhood the podcast discusses, I've had Dr. Zitter on. We've talked about end of life issues. I had her on after my mother passed because I had questions about that whole process. And I know other caregivers did as well. I spoke with Teepa Snow about caregiver burden. I've covered empathy and caregiving. I've talked with Howard Gleckman about the coverage and the policies of caregiving and how we can try to change policies and how caregivers can't march on Washington because we're taking care of our people. So how do we get Washington to pay attention to what it is we're doing? I spoke with Jason Karlowich about his book, The Problem of Alzheimer's, which chronicles, if you haven't read the book, it's fascinating. It chronicles how Alzheimer's was discovered and the process that we've been in since it's been discovered and why there hasn't been movement. It was one of those books where I had to read a chapter and put it down and walk away because I was just blown away by everything, by the lack of attention and by just the frustration. So I try to talk about the issues that affect caregivers from a caregiver's perspective, because there are so many things that are under the topics that we need to discuss. Let me see here. Done a number, let's say here. How to navigate the issue of loved ones refusing support services. So what I've heard from other people and what's worked for me personally, whoever I had to come in, and I did use an agency, and then I wound up hiring someone privately. And I would bring them in and tell my mother that this was my friend from high school, and she happened to be in the area, and she was so excited to stop by to say hello. And I would sit in the room for a little bit, and then I would leave. But it's that I always had in my mind, it wasn't about you need help. It was about I needed help, or this person wanted to stop and see you. So I tried to flip it because I never wanted my mother to feel like she was anything less or that she needed help. But I knew that it would appeal to her if I said I needed help. So that's how I flipped it around. The name of that book was The Problem of Alzheimer's, and it was by Dr. Jason Karlowich. He's a neurologist at the Penn Memory Center in Philadelphia. Navigate. Let me see here. We have another question. Hold on. Advocacy with limited capacity. Yes. Oh, when I spoke with Howard Gleckman, I said to him, we always hear about writing letters or calling our congressman. And does that really do any good? Because I feel like sometimes it's screaming into a void. He said writing a letter is better than telephone calls because they just simply mark down the telephone call. But the letter they have to record. So if you can write a letter, that would probably be great. And even if you did it in chunks, because again, in those moments of why is caregiving hard, it's hard to try to formulate that because there's so much to this. And I think giving specific examples is helpful. But I don't know how we need to change these policies. We need to change to get more help and to get more assistance as support, because we're saving so much money. We're saving the medical community and the healthcare industry so much money. And there isn't a lot for us. And while tax credits might be great, they don't help us at 3 a.m. when we've been up for 3 days. So part of it is continuing to try to get people to hear us. I'm hoping that something that comes out of the pandemic is that the realization that there is a whole world of people out here that are caring and we need help. So I'm hoping. Let me see. Yeah. It's very hard when someone is saying about going from one care to another. It's very hard to um, keep up that continuation of care and to finish one and then start the next. It's a reserve that you have to reach for. And sometimes that's what makes caregiving so hard, because we're doing it out of love, out of a place of love, or sometimes commitment, or sometimes a duty. But any way you slice it, we're providing this care, sometimes at a cost to ourselves. And that's why it's important for caregivers to have that support, to have someone that they can talk to. And I know when I found Daughterhood, I thought, well, this is interesting. Somebody actually gets it. And I feel that that's a big part of this. There are other people that get it. There are other people that understand what is involved in caregiving. And when you're around other people that fully understand it, and you can, I can't tell you how many times I've been in a group where somebody said, nobody understands what I'm saying. And I feel horrible saying this out loud. How many times a sentence starts with, I don't want to actually say this, but, and then it's out there and everybody goes, yeah, I know, I feel that way too. And the relief that comes from knowing that you aren't alone goes a very long way, because you know you're not alone, and you know that you're not crazy, and you know that you're not a bad person for thinking that way. So I believe that part of that support is hugely important, as is education. We're sent out after a diagnosis of anything, and we're sent out to go take care of our care partners. We have no training. And part of caregiving is that training, to try to learn as much as you can about whatever situation you're in, whatever disease or condition that we have. So I encourage you to seek out support. I encourage you to find as much education as you can about each issue that you're dealing with. And I know that it's one more thing that you have to do. It becomes one more to do on your checklist, but it does come down to you, which is why it comes back to support for you as well. And there is support out there. There is support in all areas. It's sometimes a little difficult to find, but we are out there. Daughterhood Circles are there. There are local agencies that can help. Let me see if there's other things over here. I'm glad. Someone said they feel validated and it's a breath of fresh air. I'm very glad. I think the other part of caregiving that's so challenging is what happens in our own minds when we think, I don't know how much longer I can do this. I don't know how I'm going to do it tomorrow. I don't know how I'm going to do for another month. And it gets hard. And it kind of sits with us, which goes back to that grief. I don't think people realize that we're grieving, and we're grieving our relationships that we're missing, and we're grieving our time. And as much as we are giving our time, we're still losing that time. When my mother moved in with us, my children were in 8th grade. My youngest was in 8th grade, and my oldest was a senior in high school. And now one's in grad school and one's a sophomore in college. And that time, it goes. And I knew that, and they knew that. And we all worked together towards knowing that this was the situation we were in, and we were caring because they were caring as well. And I asked them about that once. I said, do you feel like our family changed? And they said, we understand what's important. So in the one hand, I have tremendous guilt and some sadness about what we missed. And on the other hand, I know that they understand the importance and what is important. And they have a very good, a good level of what to complain about and what not to complain about. Because, when you're caregiving, there's 1,000 things that you're doing all the time. And it's hard to think about you. And the other thing that I always run into when I would talk to other caregivers, former caregivers, if you will, they would say to me, remember to take time for yourself. Remember to take a little time. And I always thought, oh my God, are you kidding? You've done this. Where am I taking time for myself? And I understand it now, being on the other side of it, that caregiving does end. It will end. And you have to survive your part of caregiving. It's imperative, because you still have a life and you're going to have a life. So as hard as it is, and that's why these tips are things that you can do in your house. Caregiving through the pandemic showed me I wasn't leaving. I couldn't leave. I had a fear of, if I left and I came back and brought it back, I would never be able to live with myself. So I stayed. I was home. I was home for 2 years, and it's 18 months. It's hard, because you have to find those ways to make it through and to make it okay for yourself. And if that means going outside and standing and looking at the sun or the moon, or taking your shoes off and walking through the grass to get grounded, that's what you do. If it's your morning cup of coffee, which could be your afternoon cup of coffee, because I swear my mother had a button. As soon as I poured coffee, she would get up. I swear there was a button up here. But whatever it is for you to carve out even 5 minutes in a day for yourself, do that. It's not selfish. And maybe that 5 minutes will go to 10 minutes, and maybe that 10 minutes will go to a half an hour. But you matter in all of this. You matter in the entire equation. So I hope that there are some tips that you can take with you. I hope that there are the resources. As I said, you can come visit at Daughterhood the Podcast if you want to hear other people's techniques, or just get some information. And as I say, it's information, and it's a little company, because we all need a little company, and we all need to know that we're not alone in this, and you are not alone in this. So I thank you for giving me this time, and I wish you all well. So thank you.
Well, I think I'm up next. My name is Marilyn Sword. I have the wonderful opportunity of coordinating the Idaho Caregiver Alliance, and I've done that since about 2017, and it's a wonderful experience with wonderful people working on some really tough issues, but very worthwhile. I have the privilege of introducing our next speaker, but I'd like to take a minute and just give you a little backstory. When I started working with the Caregiver Alliance, probably in late 17, 18, I was looking around for other similar alliances around the country, and came across a woman in New Mexico who was coordinating the New Mexico Caregivers Alliance Coalition. And I called her up, and we had a long conversation about kind of how they got going and how they operated versus what we were doing and what we were trying to establish. And it was really valuable information. And I kind of tucked it away. And then once the pandemic hit, and the emphasis on the shortage of direct care staff that were available to help care recipients and their family caregivers became a huge issue in Idaho and nationally. I reached back out to her, had the good fortune of participating in a conference in New Mexico, virtually in New Mexico, last year, about this whole shortage of direct care workers. It was very informative, very helpful. And now we've tapped into her to assist us with a lot of the work we're doing in this arena in Idaho. So it's really my profound pleasure. Before I introduce her, I just want to say thank you to Daughterhood Circle. Thank you to Roseanne. Thank you for the movie. Thank you for Dr. Trump, who kicked this day off in absolutely the most profound way possible. So aren't we all lucky to be here today? Oh, so now I'll step back into my introduction of Adrienne Smith. Adrienne is the founder, president, and CEO of the New Mexico Caregivers Coalition, which is a statewide organization that advocates for and advances the professional development and workforce issues of New Mexico's direct caregivers. Adrienne's worked for international, national, and state clients in the areas of youth development, youth employment, workforce development, resource development, and advocacy. Her work includes development of national strategies to serve in-school and out-of-school youth in Honduras, Brazil, and Indonesia through the U.S. Agency for International Development. Adrienne's work also includes 4 years as Vice President of the National Jobs for America's Graduates, building program capacity within affiliated states and initiating programs in 8 new states over 4 years. She served as a lead planner for data gathered to equalize school finance funding in Texas in the landmark state Supreme Court education finance lawsuit. And she served working for Governor Ray Mabus of Mississippi from 89 to 91 as an advisor on literacy education and the state's first Commission on Workforce Excellence. She has served on the board of the Latin America Youth Center, the New Mexico Forum on Youth and Community, the National Youth Employment Coalition, and as committee chair for the American Association of University Women. She holds a bachelor's degree in biology, a master's in public policy and international administration, and she seeks opportunities for work and play with like-minded organizations and people. And that's why she's here with us. I'd like to introduce my friend that I've never met in person, but has become a good friend via Zoom, Adrienne Smith. Adrienne, take it away.
Oh, thank you, Marilyn. Thank you so much. I think I've known Marilyn for a year and a half at most. And then over this last, I'd say 30 days, I've met Jeremy Maxan, I've met Dana Gover, I've met Diana Willis, I know Destiny Triplett, Rochelle Tierney, and I'm connected to you guys now. So it doesn't matter what you do next. I'm with you and I'm a friend of yours. I'm going to do whatever I can. And we need all of your voices. So as I was thinking today, Kat, would you mind just putting my first slide up here, please? There you, and the next one. Thank you. I was wondering, what could I help say today that would make any difference at all? And I thought, I have some new friends. We're right across the street virtually. I mean, when you think about it, it's easy for us to get together by Zoom. What could I say that would make a difference? I think the most that I could do would be to share some experiences with you, the trials, the tribulations, the challenges that we've had in New Mexico in building what I feel like you're ready to do now. And you've probably already been doing this, is developing your voice, leaders, advocates for the direct care workforce. So I thought maybe one really important first statement would be this one by Robert Louis Stevenson. Don't judge every day by the size of your harvest, but by the number of seeds you plant. Because you know so well, there's so many days where it feels like you're not making any difference. You're not getting any progress. You're not seeing any progress in all the work that you're doing, but believe me, you are. Next slide, please. We had in our state of New Mexico, and I think Marilyn told you this, I didn't know anything about the direct care workforce. My area of expertise is workforce development. So it was actually a DD Council executive director at the time. That's where the real brains were. That was the person who saw what was coming in our state. And he had the foresight to say, there is a coming crisis. And so what he did was he hired me as a contractor to find out if there was a voice of a caregiver. There was, a small amount of seed funding And that executive director, Pat Putnam, then I think it was 2008, said, just go out there in the state of New Mexico and find out if there is a voice of a caregiver. And I'll tell you, incidentally, I don't think he would mind, or any of his colleagues would have minded if I'd said this, but to be clear, or to be honest, he said, we know there's a provider voice out there. That's not what we're after. We're looking for the caregiver voice. So what we did was thought about what could make the most difference in a relatively short period of time where we might be able to see some progress. And I sat with him and staff of his office, and we just together developed a work plan that spanned over the course of a year and said, here's what we ought to do. The town halls are kind of big, I think they still are in New Mexico, is a way of finding voice in our state. And town halls being, just going from place to place around the state. I didn't do my homework in terms of looking up geography, the size of Idaho, but New Mexico is the 5th largest state in the nation in terms of area. So much like what I've heard from you today, this morning and everything, a lot of the issues in Idaho center on the crisis in rural areas. We're very much the same. So we are the 5th largest state in terms of geographic area, but we've only got 2 million people. 2 million people is nothing. That's about the same size as my home state of Mississippi. So this town hall is a great way of finding out and learning from people all around the state. And there was a good degree of variability, in terms of culture, but I'll show you in a moment, there were a lot of similarities in terms of what they told us. We made an intentional decision early in the days that we started to hear from caregivers that the caregiver voice would be the most important voice. And we wanted to be sure that everyone was heard. No one voice was louder than another. And in fact, what happened was those first group of caregiver leaders who came out to us eventually became our first board of directors, members of our first board of directors. But I'll say too that there was a good degree of variability, like I talked about, from place to place in the community. But a lot of times there were organizations that came out, and this may or may not happen in Idaho, or may or may not already have happened, but there was a good bit of rumbling behind the scenes that, oh, don't worry about that group. They're just trying to unionize. And so what I have not stopped saying, just for any of you in Idaho who might encounter the same kind of thing, that I'm still saying these many years later, we are not trying to unionize, but let me tell you what we are trying to do. Next slide, please. What did we find in those listening sessions? We found what I've heard a lot of people say this morning on our panel on workforce development. Caregivers came out and told us these important things. They said we need better training, we need better education, both for those who are working in the paid professional workforce, but also about those who are providing unpaid family caregiving in the home. We want better wages, we want better benefits, we want opportunities for social development and professional development so that we can share our own challenges, worker to worker. There was a woman in Artesia who I remember saying, I'd like to be able to meet my friend who lives in Carlsbad, the neighboring town, for lunch without everybody in town talking about it, and me thinking, and them thinking I'm going to go over and work for that agency. So I've always kind of remembered that statement. Every single time I would bring up advocacy, it wouldn't surprise any of you here. Every single time I brought it up that I can remember, caregivers started to talk about their client or the consumer or the family member they were caring for. So we'd have to bring them back around and say, nope, in terms of advocacy, what I'm asking you to think about is what what do you need? If we were to go to the legislature and talk about things that caregivers need, what do you as a caregiver need? Back up on that education and training, just to kind of tell you, after doing this for 10 years, what I've come to learn and see is that caregivers know a lot more than they think they know, but they might never have been told that they're doing things right or they're doing things properly. And I thought that has become one of my big sounding blocks that I'm on right now, is caregivers actually do have all of that wisdom and all of that knowledge, but just getting a certification might make a big difference in terms of a morale booster. That's just one thing. Better wages, benefits, those things were important, and it also wouldn't surprise you, though, that was not the most important thing. Next slide, please. The most important thing that I heard over and over and over, and still continues until this day, caregivers said that the thing that they lacked and wanted most was respect and recognition they do. And we spent a good deal of time talking about that in our panel this morning. I should also mention, incidentally, that since the original town halls were funded by the DD Council, one of the difficulties I had in that first year was asking Pat Putnam, the DD Council is funding this. Isn't it important that we try to focus just on caregivers of persons with developmental disabilities? And I think, to his great credit, he said, just open the door and see who comes. And we had as many paid professional caregivers, direct support professionals come to these town hall meetings as we did family caregivers. And time again over these last 10 years, I've asked the question over and over, would you rather be in your own groups? Would you rather be separated? Should we have little smaller committees so that you all can maybe work as family caregivers versus paid professional caregivers? And time again, they tell me, we learn more from each other than you can even imagine. And I find that really interesting too. But interestingly, I think if I had maybe one thing to share that came up this morning, is that my sense is that Idaho is ready for a unified message to take out to communities, legislators, other advocates, and develop a unified message. Maybe there's something to this, that there's a direct support professional workforce, but then there are also the home health aides and there are family caregivers, and you probably have a lot more in common than you already know. Or those groups of caregivers have more in common than they know. And keep that message simple. Keep the message really simple so that legislators can understand it and not get lost in the conversation of which funding stream funds what program, and so on. Next slide, please. So another thing I thought might be important in this conversation would be to share with you a few of the how-tos. How did we do those listening sessions? We identified locations, 8, as I said, all around the state. At every single listening session, we reached out to the legislators in those areas. Almost every time they wanted to come, I was really clear in saying, we want you to give the introduction. We want you to give the welcome to those people in your communities, your constituents, but then we'd like you to sit down and listen just like we're going to do. They were fine with that. They were fine with that. It gave us some practice in partnering with local organizations, which was really good because I didn't know what that landscape was. Coming from workforce development, I didn't know any AARP chapters. I didn't know what the AAAs were or what the senior centers were about. So just making those calls and making new friends was a pretty good thing, and pretty good thing in terms of, success. Explain that you're helping to build a movement in an organization. I think that's good, a good thing to do. And then be sure as much as you can that you're listening to every single person that you possibly can. Next slide. Share your purpose, share your passion, which I know you have plenty of, and then listen. Maybe just asking some guiding questions just to make sure that you're understanding what that speaker really is trying to get at. Ask your attendees and your caregivers, what is it they hope to gain? We had a really good conversation this morning, I think, about, there are times when caregivers are able to come help, and then they've got to go do other things, and make that membrane of your organizational or your organization or whatever it is that's building this movement, make it permeable so that people feel free to come in and go back out. Ask attendees to talk about their work. I've found there's nothing better that people like than talking about their work. Start a session with how a caregiver's work fits with the larger landscape. So there's plenty of data out there, both at the national level and now, particularly since I've found out about your Living Well Project report that just came out this month. You've got lots of data to talk about in building a unified message now too. And I'm sure you've had plenty of others. And I know that a lot of these points are making it into the national news in your newspapers. Next slide, please. In our state of New Mexico, direct care is the fastest growing occupation in the state, and it has been the second fastest growing in the country. So our direct care workforce, we count as, because it's easy for Department of Labor to capture this data, U.S. Department of Labor to capture the data, home health aide, personal care assistant, nursing attendants, and orderlies. There is no occupational classification for direct support professionals. So everyone around the country that I know of uses as proxies those other three occupations. Okay, so it's been the second fastest growing in the country, but that was in the past. Next slide, please. Today, nationally, that workforce has already nearly doubled within the decade, going from 2.5 million workers in 2008 to 4.5 million workers in just 10 years. And looking ahead, we know that our long-term care sector is expected to add another 1.3 million jobs in the next 10 years. So that's more than any other occupation in the US economy. Next slide. In our state, that direct care workforce is growing rapidly in New Mexico. And you could see it from those different bar charts. The orange graph is 2009. The blue is 2019. That's the workforce growth in those occupations. And nursing assistants way out there on the right, that's declining, but that's due to the nursing homes and more people wanting to be in home and community-based services. So we'll see the share of all direct care workers in your state, and I'm sure it's probably true in Idaho too. That will continue to increase, even though nursing assistants, occupational classifications will decline slowly over time. Next slide. In our state, and I read this in your Living Well project, these numbers are very similar. 83% of our caregivers in New Mexico are female. I believe it was 81% in your state. 81% in our state are people of color, and 17% are immigrants. Next slide, please. And our wages in 2019 on average were $10.39 an hour, almost right at what Living Well Project found for the average wage in Idaho. At the same time, 10 years ago, the average wage was $10.90 an hour. So wages have actually gone down in the last 10 years. More than half of caregivers in our state work part-time, and I'm finding that the reason that is so is because they're misclassified by their employers as contract workers when they should in fact be classified as employees. And they're not able to get more than part-time work. So in our state, the caregivers that I know, they're working 2 jobs, maybe 3 jobs, just to make ends meet. Their median annual earnings are $12,800. Next slide. In our state, just like that other bar chart showed, in the next 10 years, home health and personal care aides will have more total job openings than any single occupation in New Mexico. And notice the orange bar chart for each of those occupations. All of them are low wage occupations. This shouldn't be that kind of work. Next slide, please. Next slide, please. I'm a little running out of time, so I'm going to speed this up a little. What I think you might get excited about too is some recent policy successes that we've had. So starting in 2019, just recent history, House Bill 143 would have appropriated $6 million in new funding.
Dance and Gymnastics Academy.
Sorry.
Granite Falls School of Dance. Northwest School of Dance.
Please, whomever is, we're having a lot of feedback. Could you mute your audio, please?
Thank you. I think it worked. So in 2019, House Bill 143 would have appropriated $6 million in personal care services funding, with the requirement that at least half of that be spent on wages for workers who provide personal care services through our Medicaid program. The great news was that our state agency, our State Association of Home and Hospice Care Providers, supported this bill. And one reason they supported this bill was because it was new money. But that was also the year that our governor was passing a 5-year minimum wage increase for all workers. So it was tabled, but I think that would work again, particularly if it were new money. Next slide, please. In 2020, in response to changes in reimbursement rates under the IDD waiver programs and a rate study, there were 15 of our organizations that called for better direct support professional data collection and a wage pass-through and a comment letter to our DD director through our Department of Health. And I think that was really powerful. And just incidentally, for you all doing this planning and about to make lots of noise in your state, I think one of the things that we do well is just convene a lot of different kinds of stakeholders together. And we make it possible to have different kind of sign-on letters. And that's where we spend a good bit of our time. Next slide, please. In 2021, we proposed Senate Bill 342. That would have required 70% of all future reimbursement rate increases for IDD waiver program providers be spent on a wage pass-through that would go directly to workers. And the second part of that bill was data collection that would be collected by the DD Supports Division of the Department of Health, all about workforce. So I'm sorry to say that the DD waiver provider agencies nixed that bill, and that's okay. That's one of those things. We'll come back at it. We promised them we wouldn't do it this session, 2022, which just ended, but we're real clear in saying we'll probably do that in future years. Next slide, please. And also this last summer, state senator who chaired the committee of the bill that I just spoke about, together with the Trade Association of DD waiver providers, we got together and said, hey, is there anything we can agree on here? And the state senator helped us in that discussion. And we together came up with a letter asking for more robust and regular workforce data collection. So we thought that was that was a pretty good start after several years of not agreeing on anything. I think we're in a place now where we'll be able to have future discussions and look for ways that we can collaborate. Next slide, please. And then importantly, kind of the place where you all were at the same time we were, 9 months ago, our Medicaid office sent a plan, American Rescue Plan Act, and 5 of the 6 pillars and ideas that were included in that plan were things we had direct say on being included. So the most important of them at the time was that temporary economic relief payments that would go directly to workers. And then we kind of make a big deal out of and publicly publicize the letter so that everybody sees it and different state agencies to see it. I'll say that we're in the same place Idaho's in, where it's only partially approved. And so what is this, almost 2 years now? There's no new money that's gotten down to workers specifically. So it's disappointing and it's extremely frustrating. And you wonder, if COVID-19 hasn't done it, what is this going to take? But we got to keep on going here. Next slide. What do we do today? Today, like I said, one of the things I think we do the best is convene stakeholders, have caregivers, care recipients, employers, elected officials, all in the room. We also know, we are convinced that there are better ways for caregivers to work than they do today. So we're constantly testing new things. We incubated a home care cooperative, and it's successfully running right now in Albuquerque. It's small. There are 15 employees, and all 15 have an opportunity to be member owners. But we stay really small as an organization so we can turn the ship when we need to and do new things. By the way, since March 2020, we shifted our staff time and started to spend more time on direct payments and grant assistance to caregivers so that we could send someone $300 for childcare grant assistance so that they could continue to go to work. I think that'll shift in terms of our staff time. It'll shift back to advocacy and test development and, programs that aren't so much direct assistance to caregivers as they are today. Our lens, importantly, is that of workforce development. So I can say I'm sorry a lot of the time, which I do, because I don't come from this, the DD world. I don't come from home health world. I come from a workforce development world. And next slide. We have developed through a lot of different kind of grants that we've gotten a number of different trainings. I thought that the most important one was going to be our customized training for caregivers. It includes 10 different components, modules that every caregiver ought to know. I think that made a lot of employers nervous that we were going to kind of quote, take over some training, for all workers. But I found that over the years, like I said before, it's as much a recognition of all that they do as anything else. So any program that any caregiver goes through with us, everyone gets a certificate of completion. We offer infection prevention, which is an OSHA grant. And I'm sure several of your organizations would qualify to get an OSHA grant, and safe transfer and mobility so that the caregiver himself or herself doesn't get hurt. We also do financial security classes, so that teaches people how to get online, how to stay safe online while they are there, and how to look at banking and, things like that, because we are in this kind of workforce development space. And then recognizing and reversing opioid overdose. That too was an OSHA grant. We do a lot of resource referral. Probably half the calls that we get in our office are referring to resources. And, our Aging and Disability Resource Center is one place that we think does a good job in New Mexico. And I think what happens in turn, though, is ADRC refers a lot of its callers to us, too. And then advocacy, we like to think that we do a pretty good job at that, and being loud and being noisy. Next slide. And I want to leave you with this quote that I have right up on my desk. And my husband doesn't think much of this quote. And it is what gets me up in the day, every single day. Success consists of going from failure to failure without loss of enthusiasm. So, those days when you just can't do another thing and you're sure that what you're doing doesn't make any difference, just know that's not true, because everything you're doing matters. And just like that first quote, it doesn't matter how big your wins are. You'll have small wins along the way. You may have no wins along the way, but you will have planted some seeds. And that's the really important thing. I think I'm past time. Thank you, Marilyn, so much. Thank you, Destiny. I really appreciate the opportunity to talk to my new friends here today.